Hi, my name is Tristan Woodruff, and I am interested in becoming a pediatric physician assistant, so I will be doing my presentation on the disparities that exist in adolescent health and healthcare. I am going to be discussing two specific health disparities among adolescents, along with the causes behind why these disparities exist. But first, you should know what a health disparity is. A health disparity is defined as a health difference between different groups of people. Some of these disparities may include how many people get certain diseases, the severity of the diseases, how many people die from the disease, whether people can get health care, and so on. Some of the reasons behind these disparities could be race, ethnicity, a disability, income, or a level of education. When it comes to adolescents, they are not in control of the socioeconomic status or the environment that they were born into with their parents, so they often do not get a say in the health care that they receive. As future healthcare professionals, it will be our job to advocate for our pediatric patients and make sure that they are getting the care that they need and deserve. The first disparity I want to discuss in adolescent health is obesity. Approximately 12.5 million children and teens in the United States are currently affected by obesity. That's roughly 17% of the U.S. population. This number is so large that it is even being recognized as a national epidemic. In order to understand why childhood obesity prevalence is so high, we have to evaluate the barriers that certain adolescents face. Socioeconomic status plays a large role in food consumption and physical activity patterns. According to the U.S. Department of Agriculture, 29.7 million Americans live in low-income areas that are more than 1 mile from a supermarket. These areas are known as food deserts, so their only options are convenience stores or fast food. Additionally, fresh vegetables and fruits are costlier, which lowers the incentive to buy them over a cheaper and quicker option. Neighborhoods of low socioeconomic status have less opportunities for physical activity. Low-income neighborhoods typically have fewer playgrounds, sidewalks, and recreational facilities. School environment also contributes to level of physical activity in adolescence. In a study performed by the Official Journal of the American Academy of Pediatrics, the association between physical activity and race, ethnicity, and gender were analyzed. In the study, the participants attended racially segregated schools. The results showed that Black and Hispanic adolescent girls reported lower levels of physical activity than white adolescent girls. The levels of physical activity for adolescent boys were more similar in nature. In terms of education, children with more educated parents are more likely to eat healthier and consume fewer calories. This is because education is linked to understanding what a healthy lifestyle is and how to implement those healthy choices. The next disparity in adolescent health I would like to address is mental health. Mental and behavioral health varies significantly by sex. Adolescent males tend to demonstrate higher rates of substance use, including alcohol, cigarettes, and illicit drugs. Females, on the other hand, tend to experience notably higher symptoms and diagnosis of depression. But what serves as risk factors and protective factors for these two groups? For adolescent males, connectedness with their fathers serves as a protective barrier. For female adolescents, connectedness with female friends serves as a protective factor against depressive symptoms. Social norms and social connectedness are the two largest drivers behind adolescent mental health issues. Now let's discuss two big factors that cause health disparities in adolescence, the first being race and ethnicity. Unfortunately, society often treats people differently because of their race or ethnicity, and this can be detrimental for adolescents in healthcare. Currently, 39% of adolescents in the United States are of racial or ethnic minority, and Hispanic and Black adolescents are the two largest minority groups. African Americans and American Indians, or Alaskan Natives, have higher overall mortality rates than any other population group. More specifically, these two groups have almost double the infant mortality rate of whites. Racial and ethnic minorities are more likely to be uninsured as well. In 2002, more than 20% of African Americans and more than 30% of Hispanics were uninsured. Compared to whites, Hispanic and Black adolescents are more than twice as likely to be living in families with incomes at or below 200% of the federal poverty level. Income plays a big factor in the ability to obtain health care and live a healthy lifestyle. Lower socioeconomic status in terms of income correlates to worse outcomes on a range of health status measures, including mortality, chronic and acute conditions, and self-rated health. Additionally, research on adolescent risk-taking behavior shows that as family income increases, adolescents are less likely to attempt suicide, smoke cigarettes, engage in heavy drinking, or be depressed or obese. Increased family income is also linked to adolescents having a usual source of care, such as a primary physician, and having the ability to be seen in a doctor's office. One way that the government currently assists with adolescent health care is through S-CHIP. S-CHIP is the state children's health insurance program that was designed in 1997 to cover children whose families make too much money to qualify for Medicaid, but not enough to purchase private health insurance for them. S-CHIP works by using money generated by taxes to reimburse the providers of patients who are enrolled in the program. This aid can be very helpful for adolescents who are born into low-income homes and wouldn't be able to get necessary healthcare services due to lack of family funds. Some other solutions to try to reduce the disparities among adolescents could be further implementing telehealth and using government funds to ensure that all children up to the age of 18 are covered with some kind of health insurance, whether it's Medicaid, S-CHIP, or private insurance. By ensuring coverage for all children and adolescents, it ensures that income won't be a barrier to healthcare, at least for children. Further implementing telehealth will help rural populations or those that aren't close enough or don't have the resources to get to a healthcare facility. If someone in the family doesn't have a device to access telehealth, the child can try using a school computer or accessing one from a public library. Additionally, further educating students in school about the importance of living a healthy, complete lifestyle, both mentally and physically, and providing the resources to do so can be very helpful. Here are the discussion questions for my presentation. 1. What other solutions can you propose to help combat adolescent health disparities? 2. Do you think it is the government's responsibility to provide health insurance for all children and adolescents? To what extent? Here are my references, and thank you for watching.